anatomist. So I'm going to cover the bones of the skull, the sutures, and the cranial fossa, and I'm going to start with the bones of the skull. So here's the frontal bone, and it gets its name because it's frontal. Frontal is Latin for forehead, and it's the bone of your forehead. Then the zygomatic bone here is your cheekbone. And then your maxilla bone is here, and it's called maxilla because maxilla is Latin for jaw. It's your upper jaw. The parietal bone here in the lateral view of the skull is this one here in lime green, and parietal is Latin for wall. Whenever you see the word parietal, like parietal pleura, parietal pericardium, parietal peritoneum, or parietal bone, it's forming the wall of something. The temporal bone is this bone here in salmon color, and temporal is Latin for time, because if you were to add the ear, that is the area where gray hair is brought in. Gray hair comes with time, and that's where you usually start getting gray hair. Okay, so the petrous part of the temporal bone here on the lateral side is all right there. Now I show that with an arrow, but you really don't see it because it's inside the temporal bone. And because the word petrous means rock, it's best to see that in a lateral x-ray. And it's the most dense, bright, or white area of an x-ray. It's a happy face for me if I find that. It helps me to find other structures. Now, the temporal bone is also the external acoustic meatus, which is right here. External for outside, acoustic for hearing, and meatus in a canal. It goes into your eardrum. It's that opening right there. The sphenoid bone is this here. Its form is wedge-shaped on the side of the skull. I'm going to talk more about that later. The mandible is here, and the mandible gets its name because it's Latin to chew, because it's the bone that allows you to move your jaw and chew or masticate. The occipital bone is here in this purple color, and occipital is Latin for the back of the skull or back of the skull. Now let's go from bones to sutures. Now, sutures is Latin to bind, to sew, or a seam. It's like a stitch, because here when you take a look, that's what it looks like, is a stitch or a suture. And so early anatomists said, you know, it also looks like a stitch, that. So they called it that. They used the word suture. The first suture we're going to cover is the coronal suture. It connects parietal and frontal bones. So here are the parietal and the frontal bones, and there is the coronal suture, and it courses in the coronal plane. The squamous suture connects parietal and temporal bones. So this lateral view, there's the parietal and temporal bones, and there is the squamous or squamosal suture. The lambdoid suture connects parietal and occipital bones. So there are the parietal bones, and there's the occipital bone, and that is the lambdoid suture. It gets its name because lambda is a Greek alphabet symbol that looks like that. And that's what the suture looks like. Now, the sagittal suture connects our parietal bones. So here's a superior view of the skull. There are two parietal bones, and that is the sagittal suture, which runs right in the sagittal plane. The pterion is a small suture. It's connecting our parietal, frontal, sphenoid, and temporal bones right there. And it gets its name because this is where Hermes, the god, used to put wings as well as on his ankles, is right there. And so that's why the pterion is Latin for wing. Now let's go to cranial fossae. Now, cranial fossae are three large stair-like depressions in the floor of the cranial cavity. So here's the sagittal section of the skull from a lateral view, and There's the anterior cranial fossa. A step down is the middle cranial fossa, and a step down is the posterior cranial fossa. And what separates the anterior middle cranial fossa is the lesser wing of the sphenoid bone, and the middle and posterior cranial fossa are separated by the back of the petrous part of the temporal bone. So let's take the calvarium off, remove it, and that's where we're going to see our cranial fossa is inside there. And so let's do that again. Our anterior, middle, and posterior cranial fossae, and the lesser wing separates our anterior and middle, and the petrous part of the temporal bone separates our middle and posterior cranial fossa. So let's talk about the anterior cranial fossa first. And inside that is the ethmoid bone there in green. And ethmoid is Latin or Greek, pardon me, for a sieve or strainer, something like that. Because doesn't the bone kind of look like that? Like you could view a colander with spaghetti through that, or not spaghetti, but the water going through that. And so the cribriform bone has all of these holes called the cribriform foramina. The cribriform foramina, those openings, because inside the nasal cavity or olfactory nerve ascends up to the bottom of the olfactory to the ethmoid bone, and then those cribriform foramina allow for the traversing of the olfactory nerves to the olfactory bulb, which brings sensation of smell to the brain. All right, there's the lesser wing of the sphenoid bone in yellow, and it's what's separating our anterior and middle cranial fossae. All right, now let's go to the middle cranial fossa. And two of the structures to begin are the optic canal and superior orbital fissure. There's the optic canal going into the orbit that way, and the superior orbital fissure going into the orbit that way. But because we don't see a very good view of those two structures, I'm instead going to take a look at the orbit from an anterior view. Here's the right orbit, and there's the optic canal, the superior orbital fissure, and the inferior orbital fissure. I'll just throw in for extra. So let's do that again, except we're going to take and superimpose the schematic and blow it up to make it easier to see. Say optic canal, superior orbital fissure, inferior orbital fissure. Now in the optic canal are two structures. We have cranial nerve 2, also known as the optic nerve. That's what allows you to see. That's what goes to the retina. And right alongside that, snug as a bug in a rug, is the ophthalmic artery, which is a branch off the internal carotid artery, and it supplies the orbit as well as the retina. Now in the superior orbital fissure, we have a few things as well. There in blue is the superior ophthalmic vein that drains to the cavernous sinus and also to the facial vein, and also the following cranial nerves: cranial nerve 3, 4, 5, and 6. Now, to be truthful, these five structures are not in this order. They're in different orders, but it makes it easier for me to remember them. And since it's such a small space, it works. Cranial nerve 3, 4, V1, the ophthalmic branch of the trigeminal nerve, and 6. And then we have our inferior orbital fissure, and there's our inferior ophthalmic vein that goes to the cavernous sinus as well, and the pterygoid plexus of veins, as well as the facial vein, goes two ways. And then we have the cranial nerve V2, the infraorbital nerve. It's the continuation of the V2 branch from the foramen rotundum, and then our inferior orbital artery and vein. All right, there's all those structures. So now let's go back to the middle cranial fossa. We see the optic canal and supraorbital fissure. Let's go to the next one here. And this is showing our sella turcica, which houses the pituitary gland. So here's the sagittal section, and there's the sella turcica. It gets its name because it means a Turkish saddle. I don't really see a Turkish saddle very often, but I guess that's what it looks like. And the pituitary gland goes shing and sits right inside that sella turcica. Next is the carotid canal that's located right there. Now, the carotid canal, as a canal, it goes one from the bottom of the skull and then into the middle cranial fossa. So let's zoom in on this one and go, there's our internal carotid artery, and let's focus on there. In the bottom of the skull is there's the beginning of the carotid canal, and then what we're looking at here in the middle cranial fossa is the other part of the carotid canal, and the internal carotid artery traverses that, and this is where we're seeing right now, is inside the middle cranial fossa where the carotid canal exits. The foramen rotundum, foramen for opening and rotundum for round. And the foramen rotundum is what allows for a branch of the trigeminal nerve, cranial nerve 5, and it's specifically the V2 maxillary branch that goes through the foramen rotundum. So when we look on here, there's V2, and there's the foramen rotundum, and then that nerve goes through the inferior orbital fissure and out the inferior orbital foramen, and also goes to your maxilla and palate. Now, the foramen ovale gets its name for opening that is oval. And the V3 branch of the trigeminal nerve traverses that, going through the foramen ovale, and goes and enters into the infratemporal fossa and into the oral cavity. So V2 goes to the maxilla, V3 goes to the mandible. The foramen spinosum is this very small opening, and it goes traversed by the middle meningeal artery, a branch off our maxillary artery, and it supplies the dura mater, and that is the pterion, where the middle meningeal artery courses deep to it. So if you crack the pterion, a very thin portion of the bone where that suture is, then you could rupture the middle meningeal artery and bleed, separating the dura from the skull. That's an epidural hematoma. Now let's go to the posterior cranial fossa. And inside the posterior cranial fossa, we have the internal acoustic meatus that goes into the petrous part of the temporal bone. And so there is our internal acoustic meatus, which is traversed by cranial nerve 7, facial nerve, and 8, vestibulocochlear nerve, and they all go into the internal ear where the semicircular canals and cochlea are, and those very delicate, important structures are housed in the hardest